My name is Kristen Hosey, and I am the health administrator here at the Chelan-Douglas Health District. So I've been doing nursing for 15 years. I'm a public health nurse by training, and I started out not long after graduation. I went and did the Peace Corps in Malawi as a nurse educator. So I taught nurse midwife technicians at a small hospital and did a lot of public health work around HIV, around cholera prevention, all sorts of work like that. And so that got me into wanting to catch people before they ended up in the hospital, because you would see access to care issues, or if you can prevent like waterborne illness, then you can prevent folks from having to be hospitalized. And so not long after that, I ended up at the UW, went to grad school there because I thought, I'm going to keep doing public health work internationally, and ended up getting my doctorate at the UW, worked in public health in Seattle for a while, then went back to Kenya and worked in East Africa. I got off a plane from taking a study abroad group of students to Kenya, and then moved out here like 2 days later to start the academic year in 2016 at WBC. Our role here is to promote health and to also protect communities in Chelan-Douglas from, harm. So that could be exposures, that could be outbreaks, and trying to jump in there and address if we have like an outbreak, like contact trace and get folks the care and treatment they need, but also to promote like well-being. So it's both that balance of preventing disease, but also developing folks that can grow and have a healthy life. I don't think it's like a secret that we've had a lot of turnover during COVID. So we've got a lot of, we've got a few positions open. I think there's like 5 positions open that we're trying to fill. And so there's some folks that are doing a little bit more because we're covering for those positions that need to get filled up. For some it's been a challenge, but I think we're in a good place of hope and opportunity now that we're kind of filling some of our positions up. I think before COVID, it was like an invisible job a bit because people really only thought about us for like food and pool inspections. And now I think people know a little bit more about what we do, and they might kind of see us more, but we were always there, I think. I do think that more work in homeless and substance use has been something that has been on our community health assessments for the last 2 or 3. We do these every like 3 years or so, and so do the hospitals and clinics. And that has been a high priority for the community for some time. And this year we were able to get our first like dedicated staff position for mental health and substance use. And that dovetails into like some of the homeless work too that we haven't really been able to get into as much, even though it is a public health issue. I want us to be the healthiest counties in the state. That's like kind of where I'm at. They came out with a Robert Wood Johnson report, and it's by zip code, and they do it every few years, and we're doing okay, but like I want us to be like, why not? Like, this is such a beautiful area. We have so many outdoor opportunities, great community, and so let's be the healthiest community, and that includes everything from birth to death, and everything in between. So